Thank you for coming. My name is Anne McCarthy. I'm an infectious disease and TB or tuberculosis physician here at the Ottawa Hospital and run the Office of Global Health at the University of Ottawa. And it's my pleasure to welcome you here today as we commemorate World TB Day, which officially takes place on the 24th of March. That day also marks the day that Robert Koch discovered the MTB or Mycobacterium TB bacillus. And we've made some strides since the 1880s, but not as many strides as we'd like, and that's what we wanted to talk to you today about. I'm very happy to be here today with representation from ITK, the Inuit Taperet Kanatami, as well as the Stop TB Partnership, Results Canada, and members of Parliament who've all voiced their support for global campaigns to advance World TB Day. We've seen some progress in tuberculosis, and in 2006 worldwide, we actually started to see a decrease in TB rates. Unfortunately, those rates have not decreased in places like South Africa, where there's a co-epidemic with HIV, which is disastrous. In Canada, we proudly talk about our steady decline in TB, and we have a rate of between 4 and 5 per 100,000. However, that doesn't apply to all Canadians. In our Aboriginal populations, the rate is 30 times that of other Canadian-born populations. And we'll talk about that some more in a little while. So I'm happy to have people here to talk so that we can work together to stop tuberculosis with the goal of having 0 TB deaths, faster treatment, better diagnostics, and a better vaccine, and hopefully eventually no more TB in the world. So right now I'd like to introduce Idloriak Hansen, who's the special advisor to Mary Simon. She's the acting director, executive director of ITK, and has significant experience with Inuit policy development. And I'm happy to have her here to speak to us today.
Thank you. I'm here today to tell you about the specific impacts of TB on Inuit communities. As we have already heard today, tuberculosis is a preventable disease. It is a social disease with medical characteristics. Factors contributing to the high rate of TB among Inuit include malnutrition, crowded housing, and poor ventilation, alcohol and drug abuse, and inadequate access to health care. Addressing these root causes are key to reducing the unacceptable high rates of TB in Inuit Nunangat, which is our Inuit homeland in Canada. To treat TB without addressing these underlying factors is like treating an injury with painkillers and not acknowledging the source of the pain. It will not go away. To put things in perspective, TB has been nearly eradicated among the Canadian-born non-Aboriginal population. In 2009, this group registered 1 case per 100,000 people. Rates among the general Canadian population are the lowest ever recorded. This is great news. In 2009, this was 4.7 cases per 100,000. Yet, TB rates among Inuit in Canada are similar to those seen in developing countries. Nearly 200 cases per 100,000, and they are getting worse. 2 years ago this month, we were here in this room to say that the TB rate among Inuit had doubled between 2004 and 2008, and that the Inuit rate had grown to 185 times the rate of the Canadian-born non-Aboriginal group. Well, today we are sad to report that that rate has grown once again. In 2010, it was 284 times higher. Over the past 2 years, Inuit from across Canada have taken action, collaborating on an action plan aimed at eliminating TB in our homeland. Our plan speaks to 3 broad objectives. It proposes an Inuit-specific approach to addressing TB in Inuit communities. It stresses the urgency of this issue and it takes a holistic approach, addressing the medical and social causes of TB. TB will never be eliminated until housing is improved, food security is improved, and access to health care for Inuit is closer to what other Canadians take for granted. The action plan aims to define the way forward for Inuit, address social inequities, improve access to key medical equipment and care, and minimize the jurisdictional differences that complicate the detection and management of TB in our communities. That action plan will be formally released in the coming months, but until then, I am happy to have the support of Stop TB Canada and MPs from our largest political parties. The t-shirt that I'm wearing says Taima TB, or Stop TB in our Inuit language. One of our immediate goals is to encourage young Inuit in their teens and 20s, those at greatest risk of contracting the disease and perhaps less likely to see a doctor, to get tested and get treated before they get sick. Look for these shirts and other efforts aimed at raising awareness to Stop TB in my lifetime. Thank you.
And now I'd like to introduce Joe Daniel, who's the MP for Don Valley East in Ontario, and he's the Vice Chair of the Millennium Commonwealth Parliamentarian Committee on TB and HIV.
Thank you, and I'm pleased to be here. TB is, in fact, one of the biggest killers in the world. Last year, World Health Organization indicated that 1.4 million people died of TB. And we generally think of this as a problem for the third world and for countries in Asia and Africa, but we actually have a problem also here in Canada. Last year alone, there were 300 cases of TB in Toronto, partly because of the immigration, etc. And 8% of them perished. So it is a problem that we need to tackle even in Canada, and so we shouldn't let it go, particularly with the Aboriginal community in terms of reducing things and taking care of the general issues for the Aboriginal nations. So I'm pleased to be part of this program, and I'm looking forward to working with all the different groups in trying to reduce this. And I'm also delighted to say that Canada is one of the few countries that's actually made a donation through CEDA of $30 million to the Global Fund to Reduce TB. And it's quite good given the conditions, the economic conditions. Almost all the other donor nations have not contributed to this last year. So I'm pleased that Canada is taking an active role in that. Thank you.
Thank you very much. And next, Dr. Carolyn Bennett, who's an MP for St. Paul's, Ontario, and the critic for Aboriginal Affairs and Northern Development.
Thank you very much. And it is very fitting that we have our partners from ITK today, and we're learning the new word, Taima TB, which we hope all Canadians will understand at least one word in Inuktitut, and it means stop TB, in that I think the TB rate in the Inuit population in Canada is a report card for the country. As much as we celebrate the average and the fact that there are a lot less new cases and particularly, hardly any cases in Canadian-born Canadians, that the rate in the Inuit population is a failing grade for our country. That if, as was said, that when you have to deal with these issues of overcrowding, and as the previous mayor of Iqaluit had said last year, that homelessness is not an issue in the north because it's too cold to be homeless. It means you have to overcrowd in houses, and it means 17, 18 people can be living in one house, which is just a breeding ground for these kinds of infectious diseases, particularly in the cold with the lack of proper ventilation. So I think we as Canadians have to take this TB rate in the north as our report card for how we're doing on everything to do with the social determinants of health. We cannot fix this with medicines. It is as much as we want direct observation therapy for all Canadians, as we do when we go out around the world, and we want appropriate health care in all of the communities in the north, this will not be fixed until people have proper places to live with proper ventilation and a proper number of people living in each of those houses. As you know, that it is going to be having the eyes of all Canadians on this very important indicator as to whether we're winning or losing in the equality of health outcomes for Canadians. So TB is the numbers that we use. And when you think that in 2009, there were more than 100 more cases in the Aboriginal population in Canada than all the non-Aboriginal people put together. This is extraordinarily appalling in terms of the real discrimination and racism that is part of this disease. So I hope that all Canadians are with us. Watch TB carefully. It will let you know whether we're winning or losing inequality in Canada. Thank you.
Thank you. And then we have Libby Davies, who's the MP for Vancouver East in British Columbia and chair of the Parliamentarians for Tuberculosis.
Well, thank you very much to Dr. McCarthy and to Ms. Hansen for inviting us here today to this press conference for Stop TB Canada. And I'm part of a parliamentarian group called the HAT Caucus, which is HIV/AIDS and tuberculosis. And we meet actually not frequently enough, but we're trying to get there. So there has been a very strong interest from members of parliament to work on this issue, both globally and within Canada. And I know that one of the issues that we really want to keep the pressure up on is the bill that we did have in Parliament, in the last Parliament, it was called Drugs for International Humanitarian Purposes, but it was for HIV, malaria, and tuberculosis. And the bill made it through the House of Commons, and then unfortunately went no further in the Senate, but the bill has been reintroduced by one of my colleagues, Ms. Lavaderi, in February of this year in the new Parliament. So we're going to keep pushing this bill because we know it's a very important initiative, and it's been supported by many international and Canadian non-governmental organizations. And I just want to say, as far as here in Canada, I represent a riding, Vancouver East, that includes a very low-income area where the rate of tuberculosis has been much, much higher than the average population. And this is something that is entirely preventable. So dealing with underlying poverty issues, poor housing, poor ventilation, people sharing washrooms, not living in damp and moldy places. These are all breeding grounds for TB, and not having the kind of healthcare outreach into populations that are at risk are significant issues. So I know from my own community that regrettably this is still an issue in Canada, and I think it might surprise people to know that, but it is a public health issue in our own country. So I think we're here today to show our support to the campaign as parliamentarians and to commit to eradicate TB in Canada, and also to help with the global effort. And I'm very, very hopeful that the bill that we have for drugs for humanitarian purposes will receive support in this Parliament as well, and that we'll keep pressing this until it gets through. Thank you very much.
Well, thank you very much. I don't know if anybody has any questions or any other comments that they want to make with respect to World TB Day and trying to stop TB in Canada as well as worldwide. The groups that are here support not only the efforts in Canada, but obviously the efforts worldwide, and the contribution, as mentioned, from CETA and others are important for the global TB situation. Does anybody else want to say anything else?
If there's nothing else, maybe we could get it. Okay. Juste quelques mots en français. C'est aujourd'hui en mars, la journée d'arrêter la tuberculose. C'est très important. aujourd'hui de souligner les problèmes avec les Inuits au nord du Canada. Et c'est vraiment, vraiment le rapport, le bulletin, le jugement de notre égalité dans notre pays. Et regarder les chiffres pour les tuberculoses pour juger l'égalité au Canada. Merci.
I'd like to thank everybody for their participation and their support, and we can get a picture if you want to do that. That would be great.
Are you coming?
Come on, everybody.
Come on,
everybody,
that's all these
everybody.
lovely T-shirts.
Okay. Slide over to the right. To your right. Don't fall over. Right back. Just so we don't have
there he
somebody
is.
behind
Okay.
the podium. Actually, I just want them to
Squeeze over.
I'm kidding.
Marcel, is that okay?